Hello, everyone, and welcome to the part one lecture on chapter two, which is the assessment process. When we talk about assessment, in chapter one, we talked about several types of or categories of assessment that are oftentimes used just to describe what assessments are. And we describe those as intelligence, ability, career, and personality. But when we take a closer look at different types of assessments, there are several additional ways that we can describe assessments outside of these major categories. So, for example, we can talk about assessments as being labeled for a group versus an individual test. We can also say that an assessment is standardized or it's non standardized, it's speed versus power test. We can say an assessment is a rating scale, it's a projective assessment, it's a behavioral observation, or it's an interview or a biographical measure, or it can even be a physiological measure. And each of these things means something different. So I want to go through and break down what each of these things mean in terms of our understanding of different types of assessments. So, group assessments are assessments that allow information to be obtained from many people within a short period of time at a relatively low cost. So, this is what you probably think of when maybe you took the SATs or the ACTs before you got into college. There are multiple people in a room at one time, all taking the same test at the same time, and it's done so because it's more efficient and it's oftentimes a little bit cheaper because you can get a group discount for having a lot of people who are taking the assessment. An individual assessment, on the other hand, is one that permits counselors to adapt a test administration to the needs of a specific individual. So you are testing one person by themselves. And although group assessments may be more efficient to administer, individual assessments can allow for a greater attention to detail to a test taker's needs or their additional assessment methods to inform data. So, a great distinction here is that in group tests, you're typically not concerned about individual performance. But in individual assessments, you are. You might be looking at the specific way that a client is answering questions. If it's a writing piece, you might be looking at how they're holding their pencil or what information they're paying attention to or tuning to. And that information is more expensive, quote unquote, because you can only do it one person at a time, but it does have its benefit if that is what is of importance to you. We also have standardized and non standardized assessments. And standardized assessments allow for systematic approaches to the administration and scoring of an assessment and typically have clear evidence for reliability and validity. So, a standardized test has very specific rules about how you're supposed to administer a test, how exactly you're supposed to score it, and where you go with that information. And because it has been standardized, it's presented in the same way every time, it's scored in the same way every time. It tends to be more reliable and it tends to be more valid. Non standardized tests, on the other hand, are more characteristic of subjective methods, such as rating scales or biographical messages, or measures, sorry. Common standardized tests include intelligence tests, ability tests, personality inventory, interest inventories, and value inventories. Non standardized assessments oftentimes include rating scales, projective tests, behavioral observation, and even biographical measures. And the results of these tests, being the non standardized tests, tend to be less reliable and valid. But in the context of non standardized tests, it provides you with information about the person that you might not get from a standardized test. In the context specifically that you can deviate from the very specific questions that are being asked. And oftentimes we talk about non standardized tests as being part of a qualitative assessment. Specifically, a qualitative assessment involves informal and flexible procedures that are used in either individual or group counseling settings. So, this type of assessment, these non standardized assessments, focus largely on increasing client self awareness within a session. So, some examples of these non assessment based or these non standardized assessments are stimulation exercises, projective tests, and card sorts. And there's a specific type of assessment that falls in that non standardized category, which is the qualitative assessment. And that qualitative assessment is that form of non standardized assessing where you move into increasing client awareness. We also have what's called speed tests and power tests. Speed tests are primarily intended to assess reaction time or the number of items completed within a specific number, like a specific time frame. So, a lot of times, speed tests are all similar type questions that are relatively easy and that are expected that a person could complete quickly. Power tests, on the other hand, are intentionally have items of varying difficulty. In other words, the items are heterogeneous and that they may not be completed in a specific amount of time, and not everyone will be able to do them all. So, typically, as you go, the questions get a little bit harder. Speed can be a characteristic of some power tests, but it wouldn't influence the final score. So, as I mentioned, qualitative assessment is a specific type of non standardized assessment, and speed and power tests are different in the difficulty of those tests. We also have rating scales, projective assessments, and behavioral observations. In terms of rating scales, these are a common type of non standardized assessment that often can involve several rater errors. So, rating scales are where you're asking someone, all right, rate yourself on a scale from 1 to 10 on where you fall on this specific trait. And these specific rating scales can include errors like the halo effect, which is the tendency to judge an individual on one variable based on judgments on other variables. So saying, I think you're going to perform in a specific way on this variable because of how you performed on these other variables. So we're letting how someone performs in other areas inform our judgment of their skills or abilities on that second area of focus. Individuals can also fall individuals can also fall into the error of central tendency or range restriction error. And this is when, as a researcher or as a counselor using the assessment, we have the inclination to rate an individual at the midpoint of a scale. We can do this as counselors, but also clients can do this for themselves. They can say that, yeah, on average, I'm mostly pretty extroverted, I'm mostly pretty conscientious. Whatever they're being assessed for, they might put themselves close to the middle. And we as counselors can also do that if we don't pay particular attention. We can also fall into the leniency error. And the leniency error is the act of rating someone more favorably than is valid. So saying, oh, that score must not be true, I'm going to rate them differently. Like, even though that's what I'm observing in them, I just don't think that's going to be true for them across the board. So it's giving someone leniency in their score. And it can be both for positive and for negative. Rating scales can also fall victim to drift, which is a change in the way that a variable is defined over time. So if you have someone who is administering a scale, a rating scale, and they are specifically looking at how happy someone is, if they change the way that they define happiness from the first person that they administer this to and the first observation they have to the 50th observation that they have, or even just like 2 hours later, if the way that they define happiness changes, we call this drift. And this is an error in how that person is being rated. Rating scales can also be error to decay, which is the decreased reliability of how something is measured over time. So whether or not it changes how we define that trait or how we see that thing being measured over time and across culture. If there's decay in that, it's an error in how we can interpret the results today. And there are things that we can do to control for some of those errors. Specifically, raters are oftentimes asked to rank individuals relative to one another on each rating scale. So, saying if you scored yourself here on this one, how would you score yourself here on this one? And really making them rank themselves relative to one another. So, if there are 10 people in the room, who is the most conscientious, who is the least conscientious, and how would you rank everyone else in between? Another alternative is that raters can be forced to distribute their ratings across an entire scale according to a standard normal curve. So, saying, all right, you're going to be giving this rating to all 50 people in this room, and out of these 50, you can give 10 perfect fives, you can give 20 fours, you can give 40 threes, 20 twos, and 10 ones. I have absolutely no idea if that came out to 100. I just threw those numbers out, so you get the idea though, where there's a specific number of people that you can rank in a specific category, and you're forced to push people into that normal distribution. Some examples of rating scales can include semantic differential and situational tests. And semantic differential tests are the ones where raters are asked to rank order items against one another. So, saying here's the best, here's the worst, and where does everything else fall in ranking in comparison. And situational tasks are or tests are where a client is asked to perform a task that is situationally based. So they're asked to do something that's similar to whatever they're going to be doing with the assessment results. Situational tests are really common in vocational settings where you're maybe looking to hire someone into a managerial position or a supervisor position, and you give them a situational test that's similar to what they'll experience as a manager or as a supervisor. We also have projective tests, which require individuals to respond to ambiguous stimuli. And their responses are then subjectively evaluated by a counselor. So, projective tests work in the idea that you present someone with ambiguous stimuli, whether that be an ink blot or an image or something that they have never been exposed to, and you ask them to just react to it. And the idea is that if they say enough things about it, they will project themselves into their response. Part of their responses will be unconscious aspects of their personality, of their mental functioning, of whatever it is that you're trying to measure with that projective test, and it will be projected into their responses. And as a counselor, you have to subjectively evaluate them. Some examples of common projective tests are the Rorschach ink blot test and the thematic apperception test. And we'll talk more about these throughout the course of this class, but I just wanted to present them as examples of projective tests. And we also have behavioral observations. And behavioral observations are used to objectively observe and count behaviors. Oftentimes, we do behavioral observations in a naturalistic setting. So, looking at the number of times that someone has a drink at the bar, or how many times a child has an outburst or a tantrum in a classroom. Behavioral observations have the advantage of pertaining directly to a behavior that a client is concerned about, and the behavior can usually be included as part of that client's goal. The measure then becomes to directly relate that observation to the client's treatment, saying, okay, this is what you observed, or this is what I observed. You had this many drinks at the bar on this night. You had this many drinks at the bar on this night. And based on that, we can make an informed decision about what your goal is and use that as a barometer of your progress in treatment. An additional type of assessment that we talk about are interviews. And interviews can be structured where they have a very standardized set of questions that are used to solicit client data. They can be unstructured, where there is no preset list of questions, and the counselor and client interaction guides any future questions and probes of where to go from there. or they can be semi-structured, which is this balance between having a list of questions that you need to ask and then some flexibility around probing questions and additional areas of interest that you can explore. And from that, you can see that interviews can combine the elements of both standardization and non standardization, depending on what you're interested in. We also have biographical measures, which refer to accomplishments and experiences that are reported by the client or reflected in their historical records. So, this can include biographical measures, so things like their age, where they were born, how many siblings they have, but it can also include things like biodata and previous experiences. So, biodata is oftentimes part of personal records. So, previous interviews regarding previous experiences, or having clients provide information about experiences or skills that we can then use to predict future behavior. So, how did you perform in this area in the past? When you were trying to quit smoking, what did you do? How well did it work? And go from there. And the reason why we include biographical information is because there's that saying that the best predictor of future behavior is past behavior. So if we can understand how someone acted in the past, we can make an informed decision and help support how they're going to move forward with the goals that they set in counseling. And we also have physiological measures. And physiological measures are biographical or biological markers for a client's presenting concern. So maybe they're coming into you and they're presenting with anxiety. And they have biological markers in their body that will indicate whether or not they're having trouble with their anxiety or if their anxiety is elevated. So that might include things like heart rate, blood pressure, their heart contractions, their muscle contractions, their posture, whether or not their skin is conducing a lot of moisture, they're sweating. All of these are considered physiological measures that can be indicators, biological indicators of what someone is experiencing. When we talk about assessment, we've talked about the different types of assessment, but assessment is really only helpful if we can also put it into the context of how we use it in session. And really, the way that we talk about that is really by meeting the client where they're at, which I'm sure you all have heard at many times throughout your course in the MAC program. But mainly, we assess where a client's at through their stage of change. So, the assessment process is really synonymous with the counseling process in this regard. Both counseling and assessment will involve the continual dialogue between the counselors and the clients about their presenting concerns, any underlying issues, the use of various tools to understand more fully the issues that the client is presenting with, as well as the attributes that assist the client in addressing those issues. So, what support networks they have, and any ongoing interpretation, reflection, and communication of changes as we gain new information and bring that into the counseling relationship or the assessment relationship. In both counseling and assessment, it's an ongoing process. It changes throughout. We gain more information. We're conversing with the person in the room with us and using that information to make informed decision. So, in order actually, before we can ever engage in the assessment process, counselors should evaluate the stage of change that the client's in. And you've probably seen these stages before, so I'm only going to go over these briefly, but they're pre-contemplation, contemplation, preparation, action, and maintenance. In the pre-contemplation stage, individuals are not especially aware of their problems and they have no plan to change their behavior in the foreseeable future. Individuals in the pre-contemplation stage do not benefit from additional counseling sessions because they have no desire to change their behavior. Individuals in the contemplation stage are aware of their problems but have yet to make a serious commitment to doing anything about them. So counseling might be helpful to explore those things. In the preparation stage, individuals have begun to make small changes in their problematic behaviors with the intention of making more complete change within about a month. And individuals reach the action stage when they start to successfully change their behavior for short periods of time. And then we say that once someone has made changes that have persisted for 6 months or longer, they've entered the maintenance stage, in which the goal is then to maintain their behavior and attitude changes that have occurred previously. Clients enter these stages, the clients at these earlier stages, as I've already mentioned, might be less ready for counseling and may not benefit from as much of the assessment process. So, in the assessment process, you might see them lacking insight, directly resisting the process, or maybe just avoiding it altogether. And most often, clients are going to recycle through some or all of these stages several times before they successfully achieve any long term changes. So, although recycling is the norm, most clients learn from their previous attempts so that they make faster progress through the cycle in subsequent attempts to resolve their problems. And from this assessment of where a client's at in their stage of change, we have four major assessment phases that are the assessment process that we follow. And they include test selection, test administration, test interpretation, and communication of findings. And we will talk about those in the second part of our lecture on Chapter 2. So I will see you all in the next lecture.